You have an appointment at 10 a.m. You arrive early. Then the clock hits 11, then 12. You finally see the doctor at 1. The hospital tells you to wait, which makes you wonder why you were assigned a specific time in the first place. Without time certainty, an appointment is just a token with hope attached. India certainly faces a doctor shortage, but the crowds in these clinics also reveal a failure in patient flow engineering. India is currently digitizing healthcare access at a massive scale. The Ayushman Bharat digital mission has already facilitated hundreds of millions of outpatient registrations. The Scan and Register system uses QR codes to eliminate the first physical choke point, giving patients instant entry into the hospital system. However, data from digitized hospitals in Hyderabad shows that even with these systems, over 40% of patients still experience long wait times. Solving the registration line only digitizes the front door. It fails to speed up care if the internal plumbing of the clinic remains broken. At the center of this breakdown is a scheduling error, the equal slot fallacy. Most clinics force a 20-minute first visit, a 5-minute follow-up, and an emergency into identical time blocks. This mathematically guarantees a bottleneck. When one complex case inevitably takes longer, it overflows, pushing every subsequent appointment back, multiplying wait times for everyone. Airlines provide live tracking for delays, yet clinics often leave their patients in a total information blackout. When a schedule is destined to fail, leaving the patient in the dark transforms a logistical error into a breach of trust. The waiting room isn't just one place. It's a cycle of bureaucratic choke points scattered throughout the building. Even with a digital ID, a patient must stop and restart a queue for vitals, billing, the lab, and finally the pharmacy. A digital medical record cannot compensate for a physically fragmented service journey. The solution is a Patient Flow OS, a systemic redesign of how a clinic operates. Smart slotting categorizes visits as first-time, follow-up, or report reviews, predicting realistic times to route patients into specialized pathways. Then, a single patient flow token moves the patient continuously through vitals, consultation, and pharmacy without restarting a single queue. This is supported by live queue intelligence. Automated updates send real-time arrival advice to the patient's phone, making the invisible wait time budget visible. Organizing clinical flow is a matter of service design. It treats a patient's time as a manageable resource. Doctors are also victims of this design. They face daily stress from unpredictable walk-ins, administrative overload, and managing understandably angry patients. For the patient, a 2-hour wait is a heavy tax, stealing productive hours from daily wage earners, the elderly, and those in pain. Healthcare dignity begins before the doctor ever enters the room. It is built into the engineering of the patient's flow.